Light periods. We're going to be discussing about light period in this video, or scanty period. Okay, this has been the question: what causes scanty period? Is it normal to have scanty period? And does it mean that when you have scanty period, you have fertility issue, or you are infertile? Okay, what else are we going to talk about? And then how to deal with scanty period. What is scanty period? Okay, now my name is Nosmerity. If this is your first time in this channel, please do well to subscribe and like the video so that YouTube can suggest it to other people. Now, scanty period is not usually what people think, okay, or light period. These are the questions we get. Scanty period is normally, or light period is when you have a period that is less than 10 mils, 5 to 10 mils of blood. Okay, usually your blood is what we're discussing now is what is scanty period. Usually your blood is period blood is supposed to be between 5-10 mils to 80 mils. Okay, so if you're having less than this, is scanty period. Number two, if your panty you changed your pad, the whole period you had, you found out that you just changed your pad 5 times, that is full, just 5 times, you probably had a scanty period. The third one is, I forgot to mention, scanty period is called hypomenorrhea, so menhagia, right? The amount of times you change your tampons or pads is maybe 4 times or 5 times throughout the entire period, and each of them was light, like a spotting. The third one is if it is just spotting, dripping. You know what spotting is? Spotting, just dripping, you're having a light period. And then finally, if your period lasted 1 to 2 days, you had a light period. Now, I made a video on why your period, what's the name of that video again I made? Period, how to know you're not ovulating. So I mentioned if your period lasts your period lasts more than 7 days or less than 3 days, you may not be ovulating, and I had so many contradictions and questions. Now, if your period started 1-2 days, your period lasted for 2 days, know that you just had 1 day, because 1 day is the main bleeding and the second day is just the outer bleeding, on your vagina trying to come out. But if it is 3 days, that means you had 2 days period. The third day is actually the blood that has the uterus has already ejected, coming out from the vagina, kind of. It's not that you are actively seeing your menses, it's just that the remaining blood, those times that the brown blood is coming out. Okay, so you see, if you're having a period of 2 days, so 1 day is the day that your uterus actually poured out the blood, then the second day is just the cleansing through the blood coming out of your vagina, and also you just had 1 day period. So 3 days period is normal. From 3 to 7 days is normal. So if you had period 1 or 2 days, you may be probably having a scanty or light bleeding. Okay, the next question we're going to be tackling on is, now, does scanty period or light period mean something bad? Now, the answer is, well, it's not likely. There are times when you may not actively bleed. Like you bleeded last month, you had heavy bleeding, or you bleeded very well last month, doesn't mean this month you may bleed very well. Some things can alter your hormones, something can make you not to bleed very well, which we'll be discussing. But however, having a scanty period doesn't necessarily mean that you are having a hormonal issue, but it can suggest that something is going on. So if you are seeing that there are discrepancies in your period gradually, from 6 days, you used to have 6 days, it's now 5 days, it's now 4 days, it's now 2 days, and then lights, please see a doctor. It also suggests that some things are going on, which we are going to be discussing. I just want to make it clear that sometimes your period may not heavily bleed for the way you bleed. Sometimes it may just occur. So which means that it may suggest something is going on. Okay, coupled, when I I start listing the causes of this, you may understand sometimes it may be normal. Okay, so it does not mean you are infertile, but it depends with some other surrounding things. If this is happening regularly, and we may have to see a gynecologist. Now, these are the causes of scanty period. I've told you that it may be normal, it may be abnormal, depending. So as I'm telling you these causes, you will now know what to do, of course. Now, number one is your period normal variation, which I mentioned. Normal, it can just be normal variation. You had a heavy bleeding last month, and this month your period just decides to be a little bit down. Okay. And number two, you are stressed. So because you're stressed, like I was stressed this month, I missed my period for like 1 week. I was heavily stressed. I know I don't sleep. Even till now, I don't sleep at night. I was fasting. I was reading. I was so stressed. I could even feel that my period wasn't going to come, because if I was my period, I won't come. So your body sees it that this person needs energy. You can imagine being stressed. Probably you're where you were not eating or something, being stressed, and then your period comes out. That person may faint. Do you get? So your body, when you're stressed, emotionally, you're thinking, you're stressed. This is why women trying to conceive has to be loved and not stressed. This thing will alter their hormones. Okay, so I was stressed and the period didn't come out, and of course when it comes, in fact I'm on my period right now, when it came out, it was just, it was not the way it was. I already know. So secondly, of course, sometimes your period come out, the first day it comes out as light, and then gradually it eases up. The next thing is, in the case of light period, you will notice that when a period is being exposed to air, okay, it becomes light. It becomes light, okay, because it's being exposed to air. So it becomes light, unlike when it is in the blood, when it's oxygenated. Okay, so this is another thing. Now, the next thing that can cause this is hormonal imbalance, polycystic hormonal imbalance. If your hormones are imbalanced, please locate that video on causes of hormonal imbalance. If your hormones are imbalanced, which can be also influenced by stress, your progestin, your estrogen, your prolactin is imbalanced, it can make you have scanty period or light period. The next thing that can cause this is weight gain. Okay, you added a lot of weight, it can disrupt your hormone, causing this thing to happen. And then weight loss. Okay, you lost weight drastically and so fast that your body thought something is going on, leading to stress. Your body will now think you're having stress. This can make your period come out light in order to preserve you so that you have more energy. The next thing that can cause this, I forgot to mention, is non-steroidal anti-inflammatory drugs like ibuprofen. When you take it up to, like, maybe in a day, maybe you took like maybe 500, depending, in a day, 500 milligram in a day. You took it so much, it can make your period come down. Because of it reduces prostaglandin, and prostaglandin, the more is reduced, the uterus can eject more blood. Okay, so you may want to reduce the way you take ibuprofen during your period, but you can take it, but not morning, afternoon, night, please. The next thing that can make you cause this light spotting or scanty period is if you have polycystic ovarian syndrome, PCOS. So this can also, I have video on PCOS. I don't want this video to be elongated. Okay, next thing that can cause scanty period is what we call salpingitis, or if you have adhesions in your uterus. Probably you had an infection, pelvic inflammatory disease, and then you had scarring of your and then you treated it, then you had scarring at your uterus. And it can alter the way your menses comes out, and it can cause infertility for you. Or you had a previous D&C during curettage or evacuation, and there were some scarring in your fallopian tubes or your reproductive organ. This can impair the way your period comes, and also make you find it difficult to get pregnant, but it's doable. Or you are having next thing that can cause this is hormonal pills. Okay, you're on hormonal pills or either any form of contraceptive. It can actually reduce the way your period comes, even in duration, in even make you miss your period and all. Okay, so please be aware of this. So these are the things that can make you have scanty period, and you now see that if you're having any of this condition, hormonal imbalance, polycystic ovarian syndrome, it becomes a problem because you may not be ovulating and conceiving may be hard. So you will now see that you have to see work hand in hand with a gynecologist. Please locate the videos on how to deal with hormonal imbalance, everything about your hormonal imbalance, what to do. Please locate that video and watch it. And polycystic ovarian syndrome, locate them and watch it in the women's playlist. And please do well to stick on this channel. If you have more questions, put them in the comment section. My name is Nurse Merit. I'm a nephrology nurse. Like this video, share and follow for more.